Hi, everyone. I'm Sarina Fazan. Thank you so much for joining us. We, of course, are continuing to talk about the coronavirus and all of its effects. Joining me right now is Dr. Deborah Boland. She is a neurologist, owns B Mobile Neurology. Doctor, thank you so much for joining us.
Thank you so much for having me today and being here.
So tell me first about B Mobile Neurology.
So B Mobile Neurology is 100% mobile practice. So that means I go to the patient's homes or assisted living facilities or dementia care units to see them in the convenience of their own place of residence.
You really are a pioneer in this field.
Yes, in some senses.
Modesty aside, you are a pioneer. You're a pioneer in this field.
Thank
You really are. It's fantastic. Well, speaking of that, though, I mean, right now, especially valuable, right?
Yes, absolutely. Absolutely. Patients obviously are not wanting to leave their home to go to the doctor. Many physicians are converting to televisits, and everybody is kind of scrambling to figure out the televisit option. My practice has had it since we opened, and that was always an option patients could use from day one.
And have you found that more and more people are contacting you now because of what is going on in society?
Yes, absolutely.
So, Dr. Boland, can you elaborate on exactly what telemedicine is?
So telemedicine is communicating with the physician remotely in whatever means or method you and the physician choose. So whether that's a telephone, whether that's a video, some people are even saying we're going to call telemedicine emails as well, right? And communicating back and forth that way, or text messaging and things like that. So all of those different resources are ways to communicate with the doctor in a remote location.
And that's what you offer through your practice, B Mobile Neurology.
Yes, we offer that consistently, and I've offered that since I've opened the practice.
You certainly are a pioneer, I feel. I know we talked about that. We touched upon that earlier, but now it seems that everybody, especially with this scare, is going towards telemedicine.
Yes, I just felt my reach would be bigger and I could see more people and influence more people. There's a lot of different limitations that have now been removed, but initially when I started, I developed the practice in a way, and I used the DPC model, the direct pay care model, so I could remove those barriers and limitations, and I could provide the services that I saw that were much needed. And we're focusing on different key strategic areas in Florida that don't have access to people like myself with my subspecialty training, and how do we get access to them, and we can do that remotely via telemedicine.
So, honestly, let's talk about what is going on in society. You are a neurologist. So many of us are talking about social distancing. How far away should we be from people? I mean, it's got to have emotional ramifications. I know it does for me because I'm a very affectionate person by nature, and it's difficult.
Yeah, it's very awkward for many of us who are affectionate, giving air hugs, giving air high fives. I typically shake every single patient hand when I walk in the door and before I leave. And, now I'm washing my hands first and then shaking their hands, and still trying to keep some of that contact, but trying to maintain precautions and distance as we can.
So, doctor, will it have long-term emotional effects on us, do you think? Or because, honestly, I was talking to my sister-in-law the other day, and she said, what's going to happen when all of a sudden we can shake everybody's hands again? I mean, are we ever going to get to that point?
Yeah, we absolutely will. At least I'm hopeful that we will. I think, it's like everything else in life in difficult times, right? There's some people who can bounce back very easily and quickly, and there's other people who have long-term effects from it, and trying to balance that now to prevent as much as we can is very important.
And how do we do that? Then how do we minimize the long-term effects?
Right, that's the million-dollar question. I think there's different things we can do. I think making a concerted effort to keep us all as connected as we possibly can, doing everything that you're doing through social media and really trying to connect the world, and doing that on an individual day-to-day basis with our families. So, for example, little things like if one of our family members who's older or maybe younger doesn't have any connection to social media, figuring out how to get them a device, getting them a tablet, getting them a phone, making sure that's in their place so they can connect with us.
Isn't that something like for years we've especially talked about our kids? They were like, don't have social media.
Right.
And now we're actually saying, okay, it's okay.
Right, within reason.
Within reason.
Right, and that would lead me to my next most important thing, I think, is maintaining a schedule. Right, so last night I was doing my own kids schedule for the day today with our nanny and making sure that, and I was trying to do 30-minute increments of learning and playtime and learning and playtime. And I think doing that for the elderly people as well, or any of the neurologically impaired people, getting them on a schedule as quickly as possible so their day-to-day routine is as normal as it can be.
And let's talk about some of those elderly patients. I can tell you in my own personal experience, my brother and his wife, they live with my parents, or my parents live with them. He is a physician. You don't need to be a doctor. I mean, you could be working at Amazon, you can be working at Publix, but he's out in the community. My father has diabetes, so he puts on a mask when he comes home and there's no interaction. And my dad told me the other day he's very lonely.
Yeah, and this is happening to so many of my patients. Family members are contacting me and saying, we can't get into the facility to see our loved ones. What do you want me to do? And again, I think just, if you're in the home, keeping that 6-foot distance, right? And if somebody's sick, it's completely 100% distancing yourself. Or if you're a high-risk person, like somebody like your brother, wearing the mask, taking those protections, but trying to figure out alternative methods and ways to interact to maintain that social connection so that we all have that feeling that we are still connected.
Well, and I know you have several areas of expertise, but let's talk about patients with dementia. So, or any patient like that perhaps does not understand what's going on. How do you deal with that type of situation?
Right. So that's the big challenge. So I think going back to those basics, like I already touched on a little bit, we know that dementia patients do better if they are on a schedule, and so putting them on a schedule immediately, keeping them active and interactive in whatever format you can, not allowing them to get bored. So almost thinking of it from the perspective of, what am I going to do with my children? Looking at it from that perspective, because many of the caregivers are going to be those people who have kids and they have parents, and really almost putting those two groups of people on the same kind of a schedule.
So are there tips and resources out there? I know you've given us many tips, but are there resources out there that people, that can guide people?
Yes, absolutely. Alzheimer's Association has published many different tips, and that will be available to everyone today to get access to. The American Academy of Neurology, Brain and Life is the magazine that the American Academy of Neurology publishes, and right on the front page of their website is COVID-19 and how to deal with it with neurology patients. So,
and
from the family's perspective.
From the family's perspective.
Yes.
And you're a mom
yes.
yourself. I mean, you have 2 young ones. You have an 8-year-old and a 9-year-old. I have a 12-year-old. There's a lot of families out there right now isolating. And a question that I have for you is, with this social distancing, does that mean your own kids as well?
I think we take the information, we know the risks, and then each family needs to calculate out their own personal risks and what they want to do, right? So I think, if you're somebody who is at high risk and going to be interacting with other people who are at high risk, meaning you've exposed yourself and you have an ill person, much like your brother, then perhaps you need to distance more than a family who's 100% staying at home and they don't have anybody with any high-risk conditions and illnesses that would put them at risk for getting sicker. So I think each family has to weigh the risks and benefits as to how much they distance themselves from each other.
Such great advice, doctor. Now, if for those that are watching, how do they find you?
There's many ways. Through the social media, I have a Facebook page, Be Mobile Neurology. My website is bemobileneurology.com, and you can reach out in those ways. You can call our office, and we'll have all the information available.
Thank you so much. Is there anything that you would like to add?
We'll all get through this together.
Yes, thank you so much.
You're welcome.
Words of comfort. And thank you, everyone, so much for joining us.